Welcome to the Currents of Public Health webinar series, presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is a conversation on tobacco, new tobacco marketing, countermarketing, economics, and policy. Our guests are Dr. Lucy Popova and Dr. Zhidong Huang, who are both associate professors at the School of Public Health at Georgia State. Dr. Popova's research lies at the intersection of health communication and tobacco control, focusing on creating and evaluating effective messages that use emotion and information to reduce initiation and increase quitting of tobacco products. In her studies, she uses content analysis, quantitative, qualitative, and mixed methods. Two of her publications received Paper of the Year awards. Dr. Huang research focuses economic analysis of substance use and abuse and how prices, taxes, and other substance control policies affect the demands for tobacco, alcohol, and illicit drugs. Dr. Huang's current research involves examining the marketing and promotion of new and emerging tobacco products, particularly electronic nicotine delivery systems, or ENDS, and how policies and regulations affect use of ENDS. In addition, Dr. Huang has also conducted extensive research on the impact of tobacco taxes in reducing tobacco use in low and middle income countries. So a quick note before we start, if you have a question at any point during our conversation, please feel free to type it into the Q&A box and we will try our best to answer. So let's begin. Dr. Popova and Dr. Huang, welcome to the webinar. My first question, and as I ask these questions, please feel free to interact or just answer as best you all can based on the research that you have. My first question is, the tobacco industry has been marketing cigarettes for years and then switched to e-cigarettes. Can you explain how the industry's marketing practices have shifted over time?
Sure. So Brian, thank you for inviting us and giving us this opportunity and platform to discuss our research interest. To answer your first question, in terms of the marketing strategy of the tobacco industry shifting from combustible cigarettes to e-cigarettes. As you know, tobacco industry has been honing on their marketing strategies for a long time. And their marketing strategy has been consistent from marketing their products, targeting specific audiences, and associate their product with certain lifestyles and certain positive emotions and feelings. And more recently, to get involved with social responsibility, corporate responsibility campaigns to market their brand and image. The change is that, as you know, combustible cigarettes has been prohibited from marketing on television and print media and traditional media for a very long time. However, when e-cigarettes came into the market in early 20s, in early 2000s, e-cigarette companies had the opportunity to advertise their product on a variety of platforms, including those traditional media platforms, while combustible cigarettes cannot be advertised. And in addition to that, e-cigarette companies has also quickly realized that they can more efficiently target their audience by using social media platforms to market their product. So this is why in recent years, as you can see, as tobacco industry began to buying into the e-cigarette companies, and their marketing footprints has expanded from the more traditional media platforms to include new social media platforms.
So as a follow-up on that, I know some of your research, you've done a lot in the past decade on looking how social media has been used. And so can you go a little bit further in explaining that marketing approach that they've used to promote e-cigarettes, or maybe which type of people they're trying to target on these ads?
Absolutely. So the marketing on social media platform is different from marketing on traditional media platforms. As you know, for example, advertising on television, it is very difficult to target your specific audience, and On the social media, however, you can use algorithm and keywords, search keywords to specifically place your advertisement and that target the specific audiences that you want to reach. And in addition to that, a lot of e-cigarette companies have used social influencers and a combination of both promotion online, integration of promotion online and offline, as well as using hashtags across different social media platforms to promote their products. And as a result, one of the example is the advertising of Juul e-cigarettes on social media platforms. And our research has shown that the advertising and promotion of Juul on social media platforms has increased the awareness and the popularity of Juul e-cigarettes among youth and young adults.
So in regard to youth marketing, does your research talk about how youths are now viewing vaping and e-cigarette use?
Brian, can you repeat your question?
Yeah. So I guess in a sense, does your research explore how this type of marketing shapes youth's views on vaping and e-cigarette use?
Yes. Our research looking at how being exposed to e-cigarette advertisings are associated with attitudes, beliefs, risk perceptions, and product use among youth and young adults. And what we find was that being exposed to advertising of e-cigarettes on social media, as well as on point of sale and on television, are associated with more positive attitudes towards e-cigarettes, and associated with reduced perception of harm of e-cigarettes, and also associated with use of e-cigarettes among youth and young adults.
So shifting a little bit, how did the tobacco industry leverage the events of 2020, and by that I mean the pandemic and the Black Lives Matter movement, into its marketing strategy for e-cigarettes?
I can jump in to answer this. And thank you, Brian, for having us. Tobacco industry has been always very good at capitalizing on the things that would help them sell their products. And when pandemic rolled around and many people started, were locked up at home, not going anywhere, jobs were lost, tobacco industry saw this as an opportunity to promote their products. And we saw a lot of promotions tied into COVID, such as stay at home and vape, or there is all these delivery services that can deliver your phone, from food to your new heated tobacco products right to your home. Excuse me. And in addition, when the summer of 2020 saw the increase in social justice and racial justice movement, tobacco industry also jumped in on that. And on the one hand, they have been selling particularly menthol cigarettes to Black communities. And we know that African Americans and minorities are disproportionately affected by both the targeted advertising, and also they suffer the burden of death and disease from using tobacco products much more than white people who smoke. But in the summer, late 2020, what we saw is tobacco companies, particularly those using products that cigars, hookahs, they were using Black Lives Matters on their social media. They were talking about, we're all in this together, listening. So really using this movement to say, oh, we're in this, and using this to increase their positive image with all the people who are with their allies. And this is disconcerting because on the one hand, they're killing this population. They kill way more Black people than police brutality does, but they're not doing anything to help that. And the FDA is considering currently to stop to ban menthol in tobacco products. And we'll see how, if the tobacco industry is really with the Black community, and if Black Lives Matter for them, they would not fight that regulation.
Interesting. So can you talk about the research you did with ICOS, the heatless tobacco product, and what lessons can be learned from its rise and fall?
Sure. So ICOS is a heated tobacco product. So it's like a cigarette, but it's you don't burn it, you don't light it on fire, you stick it in this holder where a blade comes in and it heats up the tobacco inside, but to the temperatures where it doesn't start burning yet. So supposedly tobacco companies are saying this is less harmful. FDA did agree that it exposes users to less harmful substances and allowed the companies to sell this product in the US. Nowadays, companies need to apply to the FDA to get authorization to sell new products. They can't just come to the market and start selling stuff. So, but the FDA gave them the approval, and they chose Atlanta, where we are located at Georgia State, to be the first market to sell IQOS. And we have been, since 2019, we have been monitoring how this product was introduced and sold. And we've seen it, what we've noticed, they did pick up an upscale neighborhood to put their first stores, their flagship stores. But the extent of marketing and advertisement was nowhere near compared to how they were sold in other countries. Like in other countries, like in Russia, Ukraine, Japan, they had huge parties. They have all those promotions, free gifts. They have a campaign where it just showed like you can, or it's okay to do this. In the US, it was really much quieter. And Jidong can fill up on the thoughts of why it might have been.
Yeah, that was going to be my next question, and feel free to hop in. Yeah, I was just wondering, can you offer, Jidong, why it was chosen as the test market, and then, the differences between the US launch versus international launch for similar products?
Sure. So there are several reasons that we speculate why Atlanta was chosen as the first test market for IQOS. The first is Atlanta is located in the state of Georgia, which is in the southern part of the United States. As many of you know, the smoking rates is higher in many of the states in the South in the United States. And since IQOS was targeted at adult smokers, so having a large smoking population would be a prerequisite for marketing this product. So that is one of the reasons. The second reason is because IQOS, compared with combustible cigarettes, it is a relatively high price product. And therefore, you do want your smoking population to have a relatively high level of income. And Atlanta, of course, is one of the big metropolitan areas in the South. And therefore, the population characteristics, both in terms of income, average income, and smoking population, this would be an ideal location for the company to market their product. So, those was some of the reasons that we speculate why Atlanta was chosen as the first market. Of course, the other reason was because of the tobacco control policies are relatively weaker compared with other states. Therefore, it might be easier for IQOS to gain momentum among smokers in the state of Georgia, particularly in the metropolitan areas in Atlanta. So those are some of the reasons. And as Lucy mentioned, we did observe somewhat muted marketing and promotion of IQOS in Atlanta compared with its marketing and promotion in international markets. And part of the reason was because of the timing. IQOS was introduced in the US market in the late 2019. And at that time, FDA and Congress was, it was at the height of youth vaping epidemic, which really caught the attention from FDA and the Congress. So the company was under a lot of scrutiny from both the policymakers as well as educators, public health professionals, and parents regarding this new tobacco product. So in addition to that, because IQOS was required as part of the PMTA approval process to monitor its post-marketing surveillance and submit report to FDA. And therefore, all those reasons combined, and which was why we see a relatively muted marketing and promotion of IQOS in Atlanta.
So I want to ask a couple questions about countermarketing. So what all are you doing in your research concerning countermarketing? To start, that's the first question.
Well, a lot of work I do is developing messages that would tell people this product's extremely harmful and don't use them. Or if you're using, here's why you shouldn't use them, and here's how you can quit, or how you should be motivated to quit. And there's a lot of different approaches to that. And there's my work, I've done a lot on fear appeals. So how can we scare the people scare them so much that they won't be using the products? And there's some debate whether fear appeals are effective or not. And some say, especially when you show smokers the scary things, they're like, oh, this is so not effective. And others are like, oh, make it scarier. But the theories and the work I've been doing shows that when you do, first of all, they do work, but they need to be accompanied by a way for smokers to do something. So just scaring them, but not letting them a way out doesn't work. But really emphasizing the threat and really saying it is really going to kill you. So one of the messages I've tested was like a warning label that just says, imagine telling your child you have cancer, and then telling them, and you need to quit, and here's how you can quit. Here's a quit line number, use approved therapies, do this, and you can do it. And the more times you do it, the likelier you are to quit.
So I'm just curious, can you explain your process when you're doing this type of research? And I know you do focus groups. So what does that look like?
So we usually start, this is when like the different methods come in, and sometimes we call them the mixed methods, because you do some qualitative work and then you do quantitative work. And the qualitative part is usually we do focus groups. So you get people in a room, or nowadays, in a Zoom meeting, and you show them some messages that you developed. And sometimes they could be very rough and like just kind of like hand pencil drawings. Nowadays, it's easier to make them look really good. And so, but it's just kind of message idea. And you ask them, what do you think about it? You don't ask them, oh, is it going to make you quit smoking? You ask them like, what's your first reaction? And then you look for messages that really resonate with people, that make them talk about it, that evoke emotions. Sometimes you show them the message and they go, wow, or like, haha. And then other times they're like, I didn't know that. That really makes me think about, I shouldn't be using this product. This is particularly in our work. We've been doing research on how to communicate to people about reducing nicotine in cigarettes. This is another policy that FDA potentially considering to help smokers quit. And if you drop nicotine in cigarettes, and it is technically possible to vary by like 95%, that would really prevent people from starting to smoke and quit smoking. But of course, the tobacco industry is very against it. And they're saying, oh, you can't do this. Everybody's going to rebel. It's going to be a huge black market. And so our work has been developing messages explaining what does it mean. The cigarettes that with nicotine reduced is actually not going to be less harmful, because that's one of the big concerns. A lot of people believe that nicotine is the most harmful thing in cigarettes. And so if you take this part out, then, oh, they're okay to smoke. And the messages we've done do show, and we've seen people really understand that reduced nicotine cigarettes are as harmful as the regular cigarettes. They're just easier to quit. And so we do this focus groups. We get all those reactions from people. We see which messages resonate the most, and then we usually take them. Sometimes we modify them, make them look more professional, and then we do oftentimes kind of this big testing where we randomize people, and some people see a message, another group, the control group, sees some message that's unrelated to tobacco. We often use bottled water advertisements. It's kind of like the most neutral thing. And I've seen other teams do that. And then you show them the messages, and then you measure whatever outcomes. Usually we don't go as far as seeing like the behavior, because it's like one-time exposure and you measure the outcomes right away. But you can see like what's their attitudes towards the product are, what's their intentions to quit, what's their emotional reactions, and so on.
So can you delve a little bit deeper? I'm just curious about the messaging. So how do you go about tailoring a message to a particular age group or socioeconomic class?
That's a great question. Sometimes you don't need to tailor. So we often show different messages, and some research shows that if it's a really good tailored message, it works for everybody. I mean, or if it's just a general one. And other times messages are better tailored to not demographics, but psychographics. Rescue agency group that we worked in the past, they do a really good job doing targeting peer crowds based on people, kind of groups of interest, and oftentimes it's around music. So it's like people who love hip hop, they have very different values and tobacco product use than people who love country. Those people use smokeless tobacco products a lot more, and their messages would look completely different from the hip hop group. And so that's one way of targeting. Another one is developing messages that talks to specific needs of people. And so for people with low socioeconomic status, oftentimes talking about all the money they can save if they quit smoking. It's astonishing. It's like $10,000 over the course of life. That can be, you can just reach into your pocket and find that. And that sometimes is a good message.
So are there any lessons to be learned from international tobacco control messaging? And for example, you hinted this a second ago, some countries use rather graphic anti-smoking messages, and I see that more overseas than the US, but are there any lessons to be learned there?
Chidong, you want to take that?
Yeah, sure. So yes, actually, one of the research projects we conducted is to looking at the potential impact of adopting graphic warning labels on cigarette packages, and we looked at the experience of in Canada. Canada had, was one of the first countries that adopted graphic warning labels. And based on our research, we actually show that those graphic warning labels are effective in reducing smoking rates in the general population. And so it provides strong evidence to support adopting graphic warning labels in the United States. But here, FDA actually intended to adopt the graphic warning labels, but was challenged by tobacco industry in the legal courts. And so there has been some complications in terms of actual implementing the graphic warning label. That's why we still don't have graphic warning labels in the US. And but FDA is proposing a new round of graphic warning labels currently, and it's still in the rulemaking process, and hopefully it will come out soon.
Yeah, I think it's actually in the court holding process. They did release the new round of messages, and the tobacco companies sued again, and the judge is currently not making any decision on it, from kind of where I understand where it is. But kind of highlights, we do have this issue with, it's really hard to put, because of the First Amendment, that's where the grounds that tobacco industry always appeals to for the pictorial warning labels. But that's why there's, besides warnings, there's a lot of other things that companies, that the organizations and regulatory agencies and localities and states can do to work on reducing tobacco use from different angles.
Okay. Well,
yeah.
oh yeah, go on.
Oh, so I was going to say this. This really speaks to the complexity in regulating tobacco product marketing, because, as Lucy said, you know, the First Amendment free speech issues. So it is very difficult to for FDA and other federal agencies to come out and say, you know, we're going to prohibit the advertising of tobacco products altogether, because that would be immediately challenged by tobacco industry, and for violating the industry's First Amendment rights. FDA, however, does have regulatory authority to restrict certain claims, especially misleading claims, for example, about the efficacy and of certain tobacco product. For example, e-cigarette companies cannot market e-cigarettes as a smoking cessation product. FDA can also regulate other misleading claims, such as low tar and reduced harm. And FDA can also regulate the timing and the location of marketing of tobacco products, and restrict the marketing of certain products to be marketed only in locations where products where the primary audience are adults. However, when it comes to social media marketing regulation, it is even more complicated, because a lot of the posts related to tobacco products are posted by organic individual users, right? And you cannot regulate those content and those speech on social media platforms. However, there are things that the Congress and the federal government can do. For example, restricting the tobacco industry's payments to social media influencers, particularly influencers who have a large followers who are youth and young adults. Those are some of the things that the federal government may be able to do. But in general, a outright ban on advertising is it's not possible.
I think you all covered my next question. It was what role do policymakers and groups like the FDA play in tobacco products or projects and their marketing? But I think you all covered that pretty well. I do know that we talked earlier. Is there anything you want to add in that questioning about synthetic products? I know, Zhidong, you've done some research there that you might be able to share, because that's kind of a new area that the tobacco companies are exploring.
Yes, so this really speaks to the impact of tobacco control policies, as well as FDA's regulatory actions on tobacco industry. In addition to regulating marketing, FDA actually has the regulatory authority to regulate manufacturing and sales of tobacco products, and FDA can set the product standards. This is actually a very powerful tool for FDA to regulate tobacco products. For example, earlier Lucy mentioned FDA can require tobacco industry to reduce the level of nicotine in their tobacco products to a minimum level, to a non-addictive level. And this could be a very powerful tool to make tobacco products less addictive, and therefore reduce the use of those products. And in addition to that, FDA can also regulate, for example, the flavors of tobacco products, and either ban the flavored tobacco products or restrict the sales of flavored tobacco products. So those are all the policy tools FDA can do to reduce the addictiveness of tobacco products and reduce the appeal of tobacco product. However, if those policies are implemented or targeted at owning certain products and exclude other tobacco products, for example, if you only prohibit flavors in e-cigarettes, but you still allow menthol cigarettes to be on the market, right? And there is this potential unintended consequences of maybe encouraging some e-cigarette users of switching back to using menthol flavored cigarettes. So we do need to consider those unintended consequences when policies are designed. And ideally, those policies should cover all products, all tobacco products, and also recognize the different risk profiles of different products. And in addition to that, we also know that tobacco industries and e-cigarette companies are very good at adapt to the policies and regulations. For example, FDA currently has regulatory authority over any tobacco products that contain nicotine, which are derived from tobacco leaves. However, FDA does not have regulatory authority over products that contain nicotine, which are synthesized and made in the lab. So this is why when FDA started to regulating the sales of flavored e-cigarettes back in 2019, certain e-cigarette companies see this loophole in the policy, and then they started to market their product, saying that their product only contain synthetic nicotine, and therefore those products are not regulated by FDA, and therefore they can still sell their products with flavors. And so we're basically playing a sort of whack and roll game with the industry. And those are the issues that we really need to think about, and also keep up with the tobacco industry. We are always a few steps behind the industry in terms of regulating their marketing and regulating the products. And so those are the things that both researchers as well as policymakers need to really consider.
So I'm just curious, did the decision to raise the federal minimum age of sale of tobacco products from 18 to 21 have an impact on marketing in any way?
Yeah, I don't think we've seen much, and Jidong, you can correct that, but even before that raised age, tobacco companies were saying, oh, we're not using anybody under the age of 25 in our ads, and we're not using influencers under the age of 25. But of course, you look at them and they were looking young. And I haven't seen much change, but did you, Jidong?
So there are studies looking at the impact of tobacco 21, and there is some evidence that tobacco 21 reduced the cigarette smoking among certain states that had tobacco 21 ahead of the rest of the country. And in terms of marketing, we did not, there are limited research looking at whether tobacco 21 influenced the strategies of marketing by the tobacco industry. So we don't really have much to say, because we don't have a lot of evidence to support whether there is a difference. However, actually, just today there is a report came out and studying how the tobacco industry actually using the tobacco 21 age verification system as a way to target its potential consumers, and because they use a mobile device or ID to show whether they're above 21. This is actually an opportunity for tobacco industry to collect the personal information and facilitate the personalized targeting of marketing by industry. So as I said earlier, tobacco industry is very adaptive at dealing with trying to trying to deflect or reduce the impact of policies. And this is actually a great example.
Yeah, I saw that report. I thought it was really fascinating. It's like tobacco companies are pushing. So instead of the cashier just looking at your ID, they would take it and scan it. Oh, it's more precise and it's digital. And it gives tobacco industry full information on the person that they can then send all their advertisements to. And
wow, interesting. So, and I guess shifting a little bit, I'm just curious about what effect does pricing and taxation have on cigarette and e-cigarette use and cessation, and are there any unintended consequences?
Sure, I can answer that question. So research on the impact of price on smoking behavior has been there has been decades, more than 4 or 5 decades of research evidence to show that increasing the retail price of combustible cigarettes is one of the most effective way of reducing cigarette sales and preventing initiation of smoking among youth and preventing former smokers from relapsing to smoking again. So increasing the retail price of combustible cigarettes is one of the most effective policy tools that we can use to reduce smoking. And in the past few decades, we also have more and more research evidence to show that retail price is also a very important factor in determining the sales of e-cigarettes. When the retail price of e-cigarettes increase, we see a decrease in sales of e-cigarettes, and we see a decline in use of e-cigarettes. However, when there is price differential, there is a price differential between combustible cigarettes and e-cigarettes, whether it's because of the taxation, different taxation on those two products, or because of other factors, we do see we do some sort of substitution across those two types of products. So if the relative price of e-cigarettes is relatively more expensive compared with combustible cigarettes, it might incentivize some smokers to actually continue using combustible cigarettes rather than switching completely to e-cigarettes. So the bottom line is the increasing retail price is one of the most effective tools of reducing the sales of both combustible cigarettes and e-cigarettes. However, because there is this relationship between combustible cigarettes and e-cigarettes, most research evidence show it's the more of a substitution relationship. So when the relative price of e-cigarettes is more expensive, there might be some unintended consequences of encouraging keep smoking rather than switching to e-cigarettes.
So we know that the FDA has strict regulations on the US market. What regulations could we see in the future?
Well, I think the first one and most likely would be to ban flavors in combusted tobacco products. So the Family Smoking Prevention and Tobacco Control Act of 2009 banned flavors in combusted cigarettes, but left cigarillos, little cigars, roll your own, hookah, all of that is still available in flavors. And there's also menthol flavored cigarettes, which are predominantly used by African-American and minority smokers. And so closing this loophole and eliminating flavored combusted tobacco products seems like the first thing that we might see on the big federal level. I would love to see the reduction in nicotine level, because if you look at how many people's lives would be saved by the reducing flavors and reducing nicotine actually has a bigger impact. But that's, we haven't seen any recent movements in that area yet, but I am still hopeful.
Well, we have a couple questions in the chat that I'll bring up now. The first one is, if menthol is banned, do you think that e-cigarette companies will start targeting Black communities and other communities of color?
That's a good question. I think for e-cigarette companies, we have to think like a lot of e-cigarette companies are the same companies. It's, you know, all big tobacco companies have e-cigarettes in them. So yes, they will continue pushing their products. It just might be now, you know, use this e-cigarette product instead of the cigarette. You can still get the menthol there. So yeah, I think we'll definitely see that. To what extent, even if smokers do switch to e-cigarettes, that would still be better. So it's not a reason not to pass the menthol ban. And a lot of people would not switch. A lot of people say if my cigarette, my preferred brand, my preferred flavor is not available, I will just quit. And the same thing with reduced nicotine cigarettes. A lot of people say, oh, I'll try them and maybe I'll keep using them. But a lot of them are like, if nicotine is not there, why would I keep smoking? This is all the good stuff in it. It's like, if the good stuff is removed, what's the point?
It also depends on the scope of the menthol ban, right? So if the menthol ban only applies to combustible cigarettes, and it is likely that some of the menthol cigarette smokers could switch to menthol flavored e-cigarettes, or actually menthol flavored other combustible tobacco products like little cigar and cigarillos. So the potential impact of menthol ban would also depend on the scope of the menthol ban, whether the menthol ban will include other tobacco products, and whether the menthol ban will extend to e-cigarettes as well. However, even if the menthol ban covers all tobacco products, remember that I think, Brian, you had a really nice point of distinguishing the different type of e-cigarette companies. So currently, the market leaders, for example, Juul, Vuse, they are all owned by tobacco industry now, and so those market leaders, those big brand e-cigarette companies, their products will be affected by the menthol ban. However, there, in the market, there is, hundreds of thousands of smaller e-cigarette vendors and websites in particularly, and those it is going to be very difficult to enforce the menthol ban against those smaller vendors and websites. So it is also possible that people can still get continue to get their products through those websites and online vendors.
And Lucy, I think you just kind of touched on this question, but maybe you can elaborate more. Do you think FDA regulated e-cigarettes can be used as a harm reduction strategy, or do we need to know enough, or do we not know enough about the long-term health effects?
Well, I agree. We don't know yet enough of the long-term effects. What we do know is the levels of harmful chemicals in e-cigarettes are oftentimes lower. Sometimes they're higher for certain cigarettes, for certain chemicals, and for certain types. And it also depends how you use the e-cigarette, depending on the voltage and how high it heats up the stuff. And if you do dry puffs when there's no e-liquid. So there's a lot of things. But on average, I think most people agree it's, if a smoker who can't quit otherwise would switch, it will be better for that smoker. However, what I think, and FDA did recognize the differences in harm and in risk of different tobacco products, and this is part of their strategy. What I think some people are calling for is, and what tobacco companies are working for is like, let's really emphasize e-cigarettes and let's just promote them and push people to them. What I see and what I've been working on is a strategy that let's really focus on cigarettes and reducing it. So don't just say like, smoker, use e-cigarette because it's less harmful. It's smoker, use e-cigarette because cigarettes are so bad and you still don't understand fully how bad they are. But here's the information, what the cigarette's going to do to you. And if you need nicotine still after hearing all of that, and if you need, you go and use a cigarette. So a lot of times this part about really, let's keep focusing on reducing smoking and keeping communicating about how bad it is gets really overlooked in all this debate about promoting e-cigarette or not. So yeah, I agree. There's place in the overall, and there's for some smokers, and a lot of people did quit cigarettes by using e-cigarettes. We do hear that all the time. However, it doesn't necessarily work for everybody, and it's still a lot of people who are dual users who are not getting any benefits from that because they still don't fully think that cigarettes are really harmful. We did that research asking people, it's like, who are those smokers who don't want to quit? And they didn't really think about, their perceptions of e-cigarettes didn't differ from people who want to quit. They were kind of on par. What really distinguished people who never want to quit, they say, is that they were more likely to say like, oh, smoking is not bad, or I don't know if smoking is harmful. So there's still those groups of people who don't fully appreciate how bad smoking is. And smoking is really, really bad. Playing Russian roulette is safer. There's 1 in 6 chance play, put a gun to your head and shoot. Smoking kills half of its long-time users.
The other issue about the potential of harm reduction of electronic cigarettes is also we have to look at the population level impact, right? So it's not just an issue for adult smokers who are unwilling or does not want to quit, and then for them switching completely to e-cigarettes may reduce their health risks. But the issue is also, if we have this product widely available in the market, and how does it affect use initiation, and how does it affect the former smokers who would otherwise just stay absent, restrained from using smoking, but because of the e-cigarettes, now they come back of using another tobacco product and then possibly relapsing, right? And so those are the issues that we need to consider when evaluating the potential of harm reduction of e-cigarettes.
So my final question or questions is, what would you like to say to the what would you like to say to the public about the future of tobacco use and its effects on public health? And then, is there an end game strategy? So either one of you can answer those questions.
Lucy, do you want to start? I can.
Sure. Well, I think if any smokers out there or people who smoke, and first of all, the best thing you can do for yourself is try and quit. And if you've tried before and it didn't work out, it doesn't mean it's not going to work out next time. The best predictor of success is how many times you try quitting. So try and try again. And I feel that when I first started kind of my research career, I thought tobacco industry, like tobacco research, why do we need to research? It's like been done. We know everything about smoking. And then once you start getting into it, we know it's an exciting area of research. It's one place where that's where you can make one of the biggest impacts. It still kills the most people. So having effective policies and effective strategies, not only on the federal level, but on the local and state levels, that's where really things are happening. Smoke-free policies. The one issue that we're seeing coming up is the cannabis and tobacco industry getting into it and seeing how that begins to threaten the smoke-free laws and the clean air and all of that. So that's one area where we'll probably see a lot of development. And I feel like the tobacco control in states was legalized cannabis. They're already starting to work in both areas simultaneously. And then for endgame strategies, I mean, there's a lot of cool ones out there, but I would love to see the flavors out, definitely from combusted products. And then the nicotine reduction, it's like really excites me.
And I completely agree with what Lucy said. Tobacco use is still, despite in the past 2 years, COVID-19 is on everybody's mind, right? And it is probably the most significant public health issues of our time. But tobacco is still one of the most important public health issues in the United States as well as around the world. Let me just remind everybody, and each year we have close to 400,000 people die because of tobacco use, and that number, if you add 2 years, that would be close to 800,000 people would die from tobacco use in the past 2 years. So and in the world every year, there are more than millions of people die from cigarette smoking. So this is still one of the most significant public health issues, yet sort of under appreciated by a lot of by public, by the policymakers. And so this is an area where the research and policy can really make a difference in improving the public health in the United States and around the world. And there are also those new areas where we need to focus on. For example, as Lucy said, now it used to be the tobacco market was just dominated by combustible cigarettes as well as smokeless tobacco product, right? But now the tobacco market is so diversified. We have different kinds of electronic cigarettes. We have heated tobacco product. We have synthetic nicotine products. We have new oral nicotine products. And those products really pose a significant challenge for the tobacco control work as well as research. And in addition to that, there is as states are becoming more and more lenient towards the regulation of cannabis product, there's also a sort of a merging of those two products together. So tobacco and cannabis are used together by a lot of people on a lot of occasions. For example, blunting, right? And vaping cannabis oil. So those issues really pose challenges, and also those are the really new research areas that need to be explored and better studied. So this is also a very exciting time to study tobacco control and study the impact of policies that regulating tobacco products.
Well, I want to thank all of you for attending the Currents of Public Health webinar today. And I want to especially thank Dr. Popova and Dr. Wong for participating in this informative conversation. I think we all have learned quite a bit, so I do very much appreciate their time. Please save the date for our next webinar on Thursday, March 24th at 12 p.m. featuring Dr. Jolene Arias, who will be discussing bringing Alzheimer's disease and precision medicine to public health. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, and a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe, and our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. And also you can check out our alumni page at publichealth.gsu.edu/alumni. Thank you again to our guests, and thank you all for attending. Please join us for our next webinar.